Dry needling is a technique utilized by physical therapists, chiropractors, and other healthcare professionals to treat musculoskeletal pain and dysfunction. It's usually part of a comprehensive plan that utilizes exercise, manual therapy, and other modalities to treat dysfunction and pain. I'm Daniel Sellers, a physical therapist with Salina Regional Outpatient Physical Therapy.
Well, Daniel, thank you so much for coming on the show. First of all, what is dry needling? And it's really different from acupuncture, right?
Correct, yeah. Dry needling is what we use in Western medicine to treat musculoskeletal pain and dysfunction, whereas acupuncture is used in Eastern medicine to treat qi and allow the body to heal itself with its own energy.
So how is the dry needling performed?
So we use microfilament needles, which are unhollowed needles, so we're not injecting anything, and we utilize them to push into trigger points, which are taut bands or knots, and it helps release tension in the muscles. We can treat tendonitis, joint pain, issues such as TMJ, tension headaches, back injuries, neck injuries. It can be used for anything that the trigger points become present after injury. Each session for the actual treatment is only a couple minutes, and depending on how the tissue resolves, as far as the way the knots hold in the tissue, it can be a couple sessions to a longer amount of time frame.
Okay, we're going to switch gears here a little bit and talk about another condition that maybe people aren't really familiar with, Bell's palsy, and you're actually doing some physical therapy to help with that. Why don't you talk about that?
Correct. So Bell's palsy is when the facial nerve is involved with illness or inflammation, and it causes paralysis of the muscles that start from the eyelids and go all the way down towards the mouth. We utilize electrical stimulation, and we help reeducate the muscles, so the muscles that are paralyzed, they can regain their function.
And like that, what do you do for the patients?
So they'll come in, we'll assess the degree of paralysis in the face. Usually the eyes are open, the mouth is drooped, and the muscles usually on one side there's a deformity versus the other side to where the face just isn't working. So we'll assess that to that degree, and then we'll place electrodes on the face on different points, stimulate the muscles, and as the muscles are activating, we'll have them do specific exercises that help re-educate the muscles.
Okay. Do they do any take-home exercises as well?
We do, and we provide them with the option to buy a home unit, and then we educate them on how to do that themselves.
Well, thank you so much for coming on the show and for giving us some great information, and thank you for watching. For more information, you may visit the Physical Therapy tab of srhc.com and like us on Facebook, follow us on Twitter and Instagram.